Good morning. I wish I could stand here today with more encouraging news, but the numbers are too startling to ignore. The rate of new COVID-19 infections is rising quickly. It's up 63% over the last 2 weeks in St. Louis County, and we're not expecting a slowdown anytime soon. Rates of new infection are much higher among population groups with low vaccination rates. That includes those living in the inner north suburbs of St. Louis County, where the rate of infection is 18 per 100,000. That's 3.5 times more than parts in the inner central suburbs of St. Louis County, showing how great the disparity can be just a few miles away. Countywide, the rate of infection among Black St. Louis County residents is 5 times the rate of white residents. The rates of residents in their teens, 20s, and 30s is 4 to 5 times the rate of those in their 70s. The details of the latest findings from the Department of Public Health can be found at stlcorona.com. Just click on the statistics button. Reports are weekly updated to provide information to you as much as possible during this precarious moment in the pandemic. The rapidly rising positivity rate is an indication that not enough people are being tested. If people don't know or suspect that they are positive, then they don't know to isolate. And as a result, they can't tell their close contacts to quarantine, monitor themselves for symptoms, or to get a test. With this in mind, the County Health Department is issuing a public health advisory today, encouraging all those who experience cold and flu-like symptoms to get a COVID-19 test. The symptoms commonly associated with the Delta variant, including headaches, runny nose, and a sore throat, are somewhat different than those associated with the Alpha variant of COVID, which are loss of taste or smell, fever, or cough. So if you're experiencing any symptoms at all, please get tested, even if you've been vaccinated. While the rates of new COVID-related hospital admissions are rising in our region, they remain relatively low for now. However, we expect that to change over the coming weeks based on our own experience and the experience of those in Southwest Missouri, where hospitals are seeing record levels of admissions for any time during this pandemic. In St. Louis County, we will not see the full impact of this wave of new infections on mortality for quite some time. Trends in deaths tend to lag trends in new infections by several weeks. We are hoping that relatively high vaccination rate among older adults will help, but we are not going to see another increase in deaths for several weeks. The tidal wave is coming towards our unvaccinated population. This variant is spreading quickly, and this variant has the ability to devastate those in its wake. And that's why it's so critical to get vaccinated now. The vaccines are safe, effective, and free. And that goes for everyone 12 and older. Get tested if you experience any cold or flu-like symptoms. Do not assume that these symptoms could be a summer allergy. Whether you're vaccinated or not, wear a mask when you're indoors with people whose vaccinated status is unclear. Breakthrough cases are rare, but they do happen, and the vaccines are incredibly effective at warding off serious illness. However, if someone has been vaccinated and gets COVID anyway, they may not realize it. So help stop the spread of COVID by wearing masks when you're in indoor crowds. Last year, when COVID-19 was spreading quickly, we knew little about the virus and we had no vaccine. This year, we have an effective vaccine in hand that can prevent serious illness and death and help us avoid the dark moments that we experienced during most of 2020. Thank you, and I'd be glad to answer any questions.
Can I ask about the possibility of masks returning or restrictions returning, just in case if cases continue to rise like they are?
Well, we will certainly talk about restrictions if that's the recommendation of our public health department. I think we're a little bit away from that now. Right now, we want to communicate with people the best way to protect themselves and others, and that's to get a vaccine. and to wear a mask if you're in crowds and you don't know the vaccination status of those who are around you. But we'll certainly continue to follow the recommendations of the CDC, our public health officials, and our public health experts in the St. Louis County Department of Public Health, and the experts that we consult with at St. Louis University or Washington University. But at this point, we're not talking about any restrictions or business closures.
I also know we've been talking about incentive programs a lot, and I also know about 2 weeks ago you mentioned gift cards and you were going to have some logistics. Do you have any more information about that possibly?
Yes, so the question is about gift cards and other incentives. The St. Louis County Council has authorized the use of incentives, and our health department will have an announcement about our incentive programs later this week.
Dr. Bates, there's a question that came in from Channel 2 about the rising cases has been attributed to the Delta variant. How do we know that?
So the question is about the rising number of cases and our understanding that this is because of the Delta variant that is sweeping across the country and across southwest Missouri. We've been monitoring the presence of the virus in our watershed and our sewer systems now for several months. And our health experts tell us that they've noticed an uptick of the Delta variant in our sewer shed over the past few weeks, and that is increasing rapidly. In addition, we know the Delta variant is sweeping the country. We know the symptoms are a little bit different, and that's what we're seeing right here in St. Louis County. It's much more contagious and spreads much more quickly than the previous versions of COVID. Any other questions? Okay, thank you.